Internal Conflicts and Suicide Prevention Month, a conversation with Dr. Bernadette Atanga. That is our conversation for today. Welcome to the Lawyers and Mediators International Show and Podcast, where we discuss law and conflict resolution topics to educate both professionals and everyday people. Catch regular episodes on YouTube and anywhere you get your podcast. Just remember, nothing in these episodes constitutes legal advice, so be sure to talk to a lawyer, as cases are fact-dependent. Hey everyone, welcome back to Lawyers, Mediators International Show and Podcast, the show where we talk about law and conflict resolution matters to educate professionals and everyday people. And so today we have back Dr. Bernadette Atanga on the show, where she's going to be talking about the month of September being Suicide Prevention Month and some of the work that she's done in this field to help save people's lives. So Dr. Atanga, how are you doing today?
I'm doing just fine, and thank you for having me back, Mac.
Yes, thank you so much for coming back. And, you're not a lawyer, but you come on the show frequently because we talk about the things that impact people's personal lives. Specifically, we try to address the root of conflicts and some of the ways they metastasize into negativity in people's lives. And so your work is focused all on um, prevention, but specifically in men's lives. And I know that you've been on the show before where you've talked about the book Beneath the Armor. And I'll share my screen for a second so people can be reminded if they want to go and check out this episode that you had done, episode number 320 on this podcast, where you talked about the book Beneath the Armor. And it goes deeply into how men, especially professional men, can overcome some of the issues and trauma they've gone through in their past. And so folks can check it out. Also, you had a recent talk that focuses on this topic that we're going to be talking about today with Justin Guarini on his show out in North Carolina some time ago. But before we get into that, let me remind people of who you are from you, and I'll showcase your website. So could you just remind folks who Dr. Bernadette Atanga is before we start?
Thank you. So, briefly, I'm a physician by training, and I'm also an author and a speaker, and I've done a lot of work internationally in Africa, in Europe, and here in the United States. Why men? I actually started advocating causes for women and children. And in taking them to men, I realized that they had a greater need to help the conflict that we're experiencing in community. And so, and again, the last 20 years, my practice was in the VA, which is 90% or more men. And so, yes, it has been really rewarding to actually work with a community that feels left behind as far as emotional health is concerned, and to find the avenue that I can help people get to the need. This month, when we talk about suicide prevention, it's also because that's internal conflict that lead people to that place. And as we know, suicide is 4 times higher in men. So I think it's a really important topic for this month.
Yes, thank you. And you posted recently on LinkedIn, your topic about Suicide Prevention Month, and I reposted it and I shared the fact that that it goes pretty well together with October, which is Conflict Resolution Month. And the thing they have in common, these 2 months, is this talk and focus about internal conflicts. And that's why we titled today, Dealing with Internal Conflicts. So, can you give us just some of the basics that you want people to remember about this month? And then we'll go into a recent talk that you had given with Justin Gorani.
So, first of all, suicide is like taboo, even much so than mental health. But what I want people to realize is that it's just a health problem. And I say, your brain is in your head. It's an organ just like your heart. So I want people to really, if anything, feel comfortable dealing with this as a mental health medical issue, first of all. Secondly, suicide is like, I would say, the end stage of something like depression, but it's preventable. So we can know when people are going through suicidal ideation, when they're just thinking about it, or we can help people before they get to that point of internal conflict that they feel there is no way out other than suicide. Because it's not just that person that takes their lives, the families and the loved ones that are left behind have to deal with that aftermath as well. And then why men? Why am I focusing on men? Like I said, they are 4 times more likely to commit suicide than women, less likely also to access mental health when they need it. And it comes down to that fact of society has raised men not to express their emotions properly, to hide their pain when they suffer, whether as young boys as they're growing, as young adults, and also in relationships. So you can have somebody going into a relationship happy, but is not prepared to deal with the challenges that life presents. And then when they face that, they're not able to express themselves. And so the problem now morphs into more complicated issues where now they feel the helplessness, they feel sense of guilt, they feel hopeless. And so when there is no way out, they just think, I'm better to be out of here. But we can prevent that. And that's why we're talking about it.
Yes, and it's a very big, big, important subject for me when it comes to the family law world. You know, as a mediator, I'm dealing with people sometimes in conflict over children, and sometimes you hear one parent say something like, um, "Oh, you're not a provider," or "Oh, you're a loser." You know, some folks in family law will say the meanest thing. Sometimes it's punishment or as an attack, but I'm raising this because then you start seeing that sense of hopelessness that you've just described in the up opposing party side. And many times, if people don't get an opportunity to put this stuff out and speak it, especially at the mediation table, they never get a chance. And because the alternative to mediation is to go to court. And when you're in court, a lot of times a judge just tells you what to do. And that stuff just starts getting bottled down. So it's an important topic we have to discuss. You're right, it is taboo. But I want to share a short video where you recently were talking about this with Justin Guarini. This is back in March. And so this goes to show that you had been discussing this way back in the spring about this important topic that now we're bringing attention to this month. So here it is, and I'll let you comment about it right when we finish. It's very short.
Express it.
Okay.
Other thing, men are supposed to be successful. Like they get the jobs, they get everything. But
Hunter-gatherers.
what do the statistics show? Higher rate of suicide.
Mm.
So if they have it all and they are that good leaders, how is it that at the smallest amount, just when they face in the slightest discomfort, they turn to suicide? So that's because they don't have the appropriate coping mechanisms.
Right, that
Now,
outlet.
other groups do have that,
Sure.
but it's highest in men. So I think the statistics tell us we have, and even professional men more so.
Sure, absolutely. And yeah, in a professional sense, it's like, if you're the president of a publicly traded company, or if you're someone in a high visibility leadership position, you can't show weakness, right? Because that may negatively affect the company, may negatively affect the bottom line.
So can you just continue to expound on that a little bit about what you had shared there?
Yes. So especially if you heard I said, especially professional men. So there are categories and professions that are more at risk of suicide than the general male population. Professions, believe it or not, physicians. Okay, and I think we talked about this some time ago. And other professions that face trauma, first responders, right? So I had someone who was a first responder paramedic, and they told me they have seen more trauma in their job as a paramedic than the time they served in the military. So we forget that people get exposed to a lot of things. So it's not just internal conflict from personal life, but it may also be from your job. Police officers. And so highly professional men, I have ideas why that could be, in professions that are not high risk in terms of suicide. But again, relationships. So if you realize, we've talked about people are raised not to show emotions,
Yep.
and they're taught to suppress them. Now, however, we have other emotions that seem acceptable for men, like anger, aggression. We accept that, but we don't realize sometimes men show depression in through anger or anxiety. People always think you're withdrawn, more women would show it more that way, but a lot of times the symptoms of depression in men does not come out the classical way, and because they have to portray strength. So in their despair, it's anger, whether it's, you see that in relationships, how they express it at work. So when we talk about prevention, when we see people behaving that way, we need to, bring their attention to getting help. And a lot of times for me, I would have a patient come, male, and would say, I don't know why I'm here. My wife and my children say that I need to talk to someone. They say I've changed. So they are not aware, but at least they trust their loved ones to say, we think something is not right. So this is a word to people who, if your loved ones tell you your behavior is off, it's not just because it's irritating them. They may actually be trying to save your life. So that, and then we talk about professional men also, because you talked about family law. A lot of times, men commit suicide when they feel they've lost everything through a divorce. There is a high rate of divorce also, of suicide men, when they feel their partner is leaving them and they're hopeless or it's final. We see that also in young men, high school. You see a lot of young men commit suicide just because their girlfriend left them.
Mm.
So, and again, at that age group, about the teenage age to about 35, suicide is the second leading cause of death. So, this is really important in terms of our healthcare.
So in your book, you talk about strategies, okay, that you believe can help protect against suicide ideation. Could you share one of those strategies with us to help explain how it can dismantle this emotional armor that men put on?
Yes. So, in the book, the Beneath the Armor, and I talk about strategies for men to embrace vulnerability and lead with authentic strength. And those words are chosen carefully: the vulnerability, leading, and authentic strength. Why? Because, most men find themselves in position of power at work or at home. So it's innate to think the man is the head of the house. I didn't make that law, but we grow up in that situation. And so on the home front or the work front, if a man starts feeling inadequate for whatever reason, for whatever, there are many reasons, whatever challenges, maybe they lost their job or they have an illness that is affecting their relationship, and things that degenerating from there, because they don't have, or most people do not have the skills to name their feeling, which is one thing that I talk in the book, to be able to name their feeling and know where it's coming from and know why, the root cause, and be able to get the help that they need. So that's one strategy. If you're able to do that, then you're on the path to getting help, as opposed to staying in despair and in the part of, leading to maybe a terrible outcome as suicide. So that's just one of them. Shame is another thing I talk about, because depression, where we have guilt, we have shame, we have feelings of hopelessness and worthlessness. Again, because you talked about men as providers, their identity is tied in their ability to provide. Unfortunately, we've linked that just to providing material things or providing money. But we don't realize people, you provide security, you provide love, you provide a safe space, you provide support, you provide being a good partner. So you may find a man who has all these other options of being a provider, and they are actually being and doing that. But if they lost their job, an inability to provide financially, be it temporarily, that can really rock their identity and their sense of being a leader. So they need to embrace that vulnerability to realize this is not about you as a person or failure as a person. It is a temporary situation. It will come to pass. And with the right strategies, you can change things. Because a lot of times the helplessness and the hopelessness is because I can't do anything.
Mm.
Whereas you can. Talking to people, joining support groups, those are strategies that people can take, and not just when they are in problems. So women do this better. And that might be the reason why suicide rate is less in women. Depression is more, but suicide rate is less compared to men. I think it's because women generally tend to form a good social network where they talk to each other. And that alone, even without formal therapy, does help. Now, you definitely, if you have access to it, get formal therapy. And also because some people may actually need medications. And I tell people it is a medical condition, no differently from your high blood pressure or your diabetes. So if you think of it as a health issue, it is not a fault in your character. It's not weakness to feel depressed. And when you talk about suicidal ideations,
Mhm.
it is very important because some belief systems make you feel terrible to even have that thought. And it may not be a thought of, I'm going to kill myself. It may just be the feeling of, life is not worth living. I don't want to be here anymore. Talk to somebody.
So when you talk about talking to somebody, I think of the word you used earlier, which is network. That women, for example, have prob- are better at being part of a network than men. And I remember hearing some time ago where it was said that men who go through divorce tend to be very isolated. Like they tend to do these things alone, and the emotional roller coaster and the experience of it is very internalized. Whereas women might have others that she can speak to about the process. And I know one thing you've done in this at this point, you've created a Facebook group, right, called Beneath the Armor that people can join, not just to talk about suicide ideation ideas, but anything that men who might feel vulnerable or who might need to show vulnerability would want to hear by discussing with each other. So, can you talk a little bit about that Facebook group that you set up?
Yes, it's very new. So this is we're talking. It's a very new group.
Mhm.
It's called Beneath the Armor, taken from this, and it's a private group, so you have to be admitted into it. So just go ahead and request. But the purpose of that is to create a safe space where we can discuss things that people don't have a network to discuss it. Because when you realize that you are not alone, which is a phrase that I keep repeating in the book, you're not alone when you realize that there are other people going through this. There are other people that feel the same way. Then it normalizes it for you. And you start seeing, okay, if so and so was able to get over it, if this is what they did, you start realizing, okay, there is hope. There is light at the end of the tunnel. So that's the purpose of this group. It's Facebook, it's Beneath the Armor. And I think you would recognize it by just that
Yeah.
with the Armor logo there. So go ahead. I encourage your listeners, men and women. And the reason is a lot of women have read this book, and I have great reviews from women. I just in the last 2 days, I went to my dentist and somebody talked to said, "Oh, this is exactly what my husband is going through." They purchased the book. I was talking to another person yesterday, said, "This is my husband. I purchased the book." And again, because like I mentioned, the women or children or the people in the men's lives, they are the, I would call them first responders, because they are sitting first line to see those symptoms. And you don't have to be a psychiatrist to know that something is not right. So they are the ones that can be your mirror to see that and then either ask for help or get you help, whether it's buying beneath the armor or encouraging you to go talk to your physician or to talk to another specialist.
So when you speak about the people in your life as being the first responders, you talk about practical and hopeful ways to connect with men who are in crisis. Can you provide some concrete examples of how a family member or a friend could approach and support a man who they're concerned about?
Yes, so if we're talking about suicide directly. Now, there are different stages. So they may just realize that this person, your spouse, your brother, whoever is getting more isolated and something is wrong and they're not talking about it. So you don't have to know exactly what it is, but you just have to encourage them to discuss and, encourage them to talk to someone or bring in someone who can talk to them who they feel trust. Because the other thing is people have to trust you to open up to you. Another thing is behaviors that are at risk, substance abuse, alcohol use. So sometimes people think, it's just alcohol or they're drinking a little bit more. It's not the alcohol, it's a symptom of something. Addiction is a bigger it now, and I'm glad we call that a disease. Addiction is the symptom of something. It's internal pain, internal conflict that you're using substances to numb the pain. And why numb the pain? Because life taught you not to feel. And as you go, these situations happen that you are forced to feel bad. And that that feeling of numbing the pain keeps you in that place of addiction. So, and it is not easy. So people have to try different strategies to see whatever works in that situation. Sometimes talking about network, family members have their own network. So, like you have Alcohol Anonymous, you have Al Anon, which is family members of alcoholics. And so there are support groups for family members to learn how to deal with the situations. NAMI, which actually the National Alliance for Mental Illness, they do have a lot of support groups, even for family members. And my last talk, I gave a keynote at their annual conference here in Michigan. And that's one of the things we talked about, where they shared resources. So NAMI is a great place. And of course, people should always have the suicide hotline number that they can access. And I'm glad they've reduced that to 3 digits, 988. So if you know of anybody, that's a number you can call. You mentioned something when you talked about family law and men. Can you now? There was something that came to mind as you were talking about that. Talk a little bit about how they respond differently to that conflict, men or women, at that point of family law and divorce.
So, from my perspective, there's like men tend to hold things in, okay, whereas women tend to be very expressive. And if I'm a mediator, and that's my role as a neutral, a lot of times there's this battle of the sexes kind of thing where men may not, especially in a divorce, want to, I guess, address any of the issues. Not that I'm a therapist, because that's not really my job as a mediator. But I can kind of sense, okay, I see the dynamics at work here as to why this marriage is having issues, because one person is trying to um, like get to a problem, get to a solution for a problem while the other person is, reserving back. It's like the dog chasing his tail. You never really get to any, solutions. And by the time that the divorce is wrapping up, it's almost too late. You feel hopeless that anything could be done to salvage the marriage. Most of the time, that's the way it is. When you're at a mediation or a divorce, it's kind of too late, so to speak. But I wonder if parents are going to be co-parenting together and they still have to deal with each other going forward, if there is still a reason why they need to keep working on these, communication skills and these interpersonal dynamics. But that's just what I've seen as far as at the mediation table. And I'll say one more thing: the isolation I was talking about. This is a very, very real thing. Men in divorce just go through it alone, and and if there's somebody's out there and they're listening to this and they're in a divorce process and they're going through it, I think one key thing we have to make sure that they know is, listen, break the pattern, seek somebody else and speak to them about the process you're going through. I think that might be a big start.
Yeah, so to that, I would say the reason they feel isolated is because, again, we have taught them not to express difficulties, express pain, and divorce. Some people think it's failure on their part, right? Because that's all. Those are the things you after your job, education. You get a job, you get married. Those are things, or you buy a house. Those are things that we count as success. So if you're getting a divorce, what does that mean? To
Hmm.
some people, that's failure, which unfortunately, that's not so. It's just another season of life. And even to realize that in your case, that divorce might actually be a good thing for you moving forward. But statistics also show that as people get older, single women are happier, men are happy if they are married, but very lonely if they are not. So
Well, yeah, go ahead.
yeah, and that's why we talked about the loneliness going
Yeah.
through a divorce. It's, so it's amazing. I think you saw this. There was a recent study came out also, statistics on happiness. They're like the older single women seem to be the. But so how is it that women can be happy by themselves, and on the other hand, men need the marriage or support to maintain happiness, and the despair that they feel leading to suicide when they lose that. So I think, like in that interview with Justin Guarini, or actually a different interview I had with him at the launch of the book, he actually talked about men can learn from women
Hmm.
about the networking. Men have groups, but it is not to talk about their emotions. It's about, hanging out at the country club, playing golf, having a drink, but it's not about getting to emotions. Not that they don't want to, we never taught them how to. And I'm hoping when I talk about embracing vulnerability, it is about embracing that, able to talk about your emotions, learn the vocabulary, because sometimes you cannot express what you don't have the language to express. So learn your different emotions, name them, and what to do when you have them. So, for example, as I say, anger is acceptable, but nothing is done until an assault happens. Then it becomes a criminal issue. So you're either sent to anger management or you're sent to jail, you pay a fine, but that's when they intervene. So we don't want it to be a law enforcement issue or to be a suicide issue. When we notice that that behavior is changing, that is the time to call the person's attention and offer them options. And you mentioned something about the words that people say to each other in that time of crisis. Again, that is unfortunate because at that moment when the man, and I'll talk about men since this is what we're talking about,
Yep.
when they feel that hopeless, they feel inadequate, they feel all the things that makes them feel less than, You have people who, in that same situation, would ask for help and would be able to do things to improve the situation. You have people who are stuck, do not know what to do, and at the slightest insinuation or reminder of their status of not being able to provide, it makes them feel even worse. So, how can people help? Being sensitive to that feeling. And I say this to either women or children. It's not that you acknowledge or you accept their inability to provide, whether it is out of just temporary circumstance or it's just somebody who is not motivated. The why is important. The why is important. If they just lack motivation, that is a sign,
Hmm.
because everybody, most people want to be productive. So when you have somebody that is just numb, they don't even have the zeal to get out there and look for a job,
Hmm.
it's not a good sign. I would say they need help more than being judged as a bad person or a lazy person. So I just want, when you say, how can people help, just to be open minded as to how depression and frustration and hopelessness presents in men, and how we can intervene or help before it becomes a suicide issue or murder suicide, as we see sometimes.
Thank you for that. And so, last question. Your background as a physician and men's wellness expert seems to give you a unique perspective. What was the moment or experience that made you realize the critical need to address this specific issue of emotional armor and men, leading you to write the book and then the work you're doing right now?
Yes. So first of all, like I said, I started with women and children, and I started all the way from Cameroon. I was in medical school in Italy when I realized how much mental health plays in our daily living, in our culture, and it was not recognized. And so my goal actually was starting there to educate people on a subject that was not talked about or was not known, and how it affected not just their emotional health, but also their physical health. And also, mostly in particular, how adverse childhood experiences affect, the way children grow up and the development of mental health issues. This was important because there were certain practices that parents needed to be aware of. Women also suffered a lot of what you may call abuse just because of certain cultures. So I started there talking with the men about what is happening to women and children. And the moment was, I think this was at a very prestigious school in the city that I grew up, a Catholic boys' school. They had their annual convention, and I was a speaker there. And I thought this was a great opportunity to have a room full of men, and these are very successful men, to tell them with the proof that I had collected from their children that this is what is going on. But as I was talking, and I was talking about how that leads to dysfunctional behaviors in adulthood, alcoholism, promiscuity, cheating on your spouse, and I dropped all of that. But as I kept talking about these adverse childhood experiences, that was the moment I noticed the shift. It went still, and they could grab at every word, because I later on realized it was not about the children they were listening to. It was their own childhood experiences that they were connecting to. And so when I finished, that's when it was almost like for the first time somebody spoke to their feelings, to their emotions, and they all wanted follow up. And their wives were present on one side. These were mothers that were, old enough to be my mother. And they held my hand, and all they said was, Mapikin, thank you, which is like my child. Thank you. And you could see that moment where you look in their eyes and you could see you just gave word to 30 years of suffering. and without knowing. And so it wasn't about bashing, it was understanding, because with understanding comes compassion. So that was to me the moment that started my journey with men. And simultaneously, I had just started my work at the VA. So, which led me now, 20 years later, I am seeing this was not just a problem in the third world in Africa, it was also in minority communities here in the US. And I thought, okay, the Caucasian community is safe. It wasn't. So even though the resources are available, it is still hard for people to access.
So, Dr. Bernadette Atanga, thank you for coming on my podcast. And so I'll leave people, with some of the information. And the best way they can get a hold of you would be on your website, atangamd.com.
Yes, they can go there and book a call.
Sure.
So they can go there and book a call, at least if they want to talk to me, or if they want me to come as a speaker, because I do a lot of corporate speaking as well.
Yes.
Because again, in leadership, they don't have access to that. And because people, they think you should be weak. Or if you ask for help, you're weak. So my goal is to get to people with education before it is a crisis. So they can, through my website, I can be booked for even workshops. I would do small workshops for people as needed. I also have, I'm going to be starting this a series of master classes. So if you, I think I would encourage people to join that Beneath the Armor Facebook group. Also, my business Facebook group, which is Bernadette Atanga, MD, and also my LinkedIn, which is Bernadette Atanga, MD, and Instagram. Because, follow me, I will be dropping this information. I'm going to be doing a lot of community events here virtually so people can register from anywhere. But if they want to book a one on one call with me, they can do that through my website.
Awesome. All
And
right.
also, definitely through Amazon. You can find the book through Amazon.
Yes, yes, beneath the armor. All right, Dr. Ortega, thank you so much for coming on. And hopefully this was very helpful. Can you tell people again the number for the suicide prevention hotline?
988. Just
Yes.
as simple as that. 988. We don't
Yes,
have to remember the very long 800 number again. And if you can remember that, call 911.
exactly. And so the goal here is to bring attention to this month of September 2025, Suicide Prevention Month. And we want to help save people's lives and help them heal and be restored. All right.
Wonderful. Thank you so very much for having me.
Yeah.
And wonderful, great work you're doing with conflict and mediation.
Yeah, absolutely. And so, folks, check this video out and all the other ones on lmipodcast.com and also on the YouTube channel. All right, everyone, take care. Bye bye.